So the Gauteng Health Department says it's taken several measures to prevent further infections at Tembisa Hospital's neonatal unit. These include the deployment of more nurses and resources by the National Institute of Communicable Diseases. 17 cases of what's suspected to be Klebsiella pneumonia were reported late last year, which resulted in the deaths of 10 babies. The bacteria is resistant to antibiotics and causes infections in the bloodstream, in the lungs and urinary tract, including pneumonia and meningitis. To tell us more, we're joined now by Gauteng Health MEC, Bandile Masuku, who's in our Pretoria studios. MEC, thank you very much for joining us here on the program.
No, thank you, and thank you for having us.
MEC, why so difficult to contain an outbreak like this?
The outbreak has been contained, and the issue is that it's one of the problems that we face every time in our ICUs generally across the province and across the country. And there are a number of factors to the effect, but the issue now currently is that the outbreak has been contained, and we are actually managing the situation quite well.
I'd have to dispute that. You haven't managed the situation quite well. There are 10 dead babies. Why? Why do you face this all the time? What is the problem?
The problem there is it's a general problem that we have in Gauteng. When we talk about overcrowding, our facilities, the demand on the service on our facilities is quite huge. And we are also seeing that a number of mothers are delivering preterm babies, which also put a bigger strain on our system. And also we see a lot of flippant use of antibiotics, which leads to resistance, because some of these bugs and bacteria and infections are easily cured if we use antibiotics studiously.
Yeah, but the reality is that sometimes, as you say, overcrowding is one of the main reasons for this. I mean, the unit reportedly has 44 beds, admits close to 90 patients. How is this possible? Why is this allowed?
It's allowed because there's a number of, all our facilities have a big challenge in terms of numbers. And currently we have a dashboard that we are operating at provincial level, which is managed by the neonatal team in the clinical governance team, which they look at all the beds and occupants in all the facilities. And they try to move patients around and where there's a demand. But there come a time where we can't even move patients around in our own facilities, and we need to make a plan with what we have.
Is there no way of trying to distribute some of these patients in other areas? I mean, there's talk of diverting new admissions to Kalafong Hospital, maybe Steve Biko Academic Hospital. I mean, shouldn't these plans already be in place, that the possibility and the risks of having overcrowding in these hospitals?
No, the plans are there. That's why I'm saying too, there is a provincial dashboard that is being managed by the neonatologists across the province, and where they look at all the beds across all our facilities and they move patients around. And this, even if when we have diverted the patients currently, it doesn't mean that Kalafong and Steve Biko don't have their own pressure, but the numbers are quite huge, and I know these are numbers that we need to have a broader strategy and a comprehensive strategy to be able to deal with the numbers as we go forward. But one of the strategies that we have already instituted is the issue of expansion of our ICU units across the province.
Yeah, this is not the first time that this has happened, and it's a story that unfortunately keeps on making the headlines. I mean, we saw back in 2018 that this Klebsiella outbreak was also there. It also happened this was at the Tembisa Hospital. No proper accountability has been taken, and it's going to happen again if something is not done. When it comes to hygiene in these hospitals, overcrowding, staff shortages, these are issues that you've had on the table for a very, very long time. MEC, what are you doing?
We have already employed a number of staff members filling up vacancies. We are in the process of doing that, not only in Tembisa or Tembisa, we're doing it across the province. Like I've said, we've already started the plans of appointing construction in terms of changing and making infrastructure changes and expansion in Tembisa. In Telemokgorane, there's a lot that has happened since 2018, and they've been able to manage the situation quite frankly. And at Bara and other places, we are working on it as we are going forward. But vacancies are being filled, infrastructure adjustments are being done, are being planned. Constructions is about to start in many other areas. So there are plans that are underway. And I'm not sure if when people talk about lack of accountability, what do they mean? Because the issue here is that we normally have to learn from the circumstances and learn from the situations that we face every day. And that's how we improve our systems.
Yeah. MEC, accountability is due to the loss of lives. And I mean, if we look at what was heard last year alone, 2,000 babies lost their lives in hospitals, in Gauteng hospitals. And accountability, you question why there should be accountability?
No, I'm not saying that. I'm just saying to you that there should be a better understanding of all of us in one space of what accountability means, because sometimes other people, we normally have a different definition of accountability. We do go through a lot of redress processes, M&M meetings, which are maternal and mortality meetings, where we go through the cases and be able to learn from them. So accountability is not the same way as other people would want it to be, and I think we need to be able to take it from that angle. But we do take whatever that is said, which is a challenge to correct it.
Okay, so we do know that one of the challenges as well is the lack of hygiene in health hospitals, in public service hospitals. What are you doing about that? I mean, a hospital should be the cleanest place because germs spread that way. People get sick, people are sick. This should be your top priority, cleanliness and hygiene in hospitals. And this is one of the causes of Klebsiella.
Not necessarily. I think you are missing the point. Klebsiella is not about hygiene, basically, and as a broader sense about how the place looks like, because all of us as human beings, we are colonized by Klebsiella, and we walk around with it. So here we're talking about a broader strategy on how we can improve hand washing as a first step. And in the ICU, it's not only the health workers that have to do that, even the parents that actually walk into the units. And we have seen cases, proven cases in research, that also we need to maybe look at even pasteurizing breast milk from the mothers, because we have found cases where a mother in a private hospital where hygiene is presumably very good, but we have this type of Klebsiella infections there, which was found on breast milk alone. So there are a number of effects and impact that we need to do, and through the infection control unit that we have, these are things that we are working at and in improving. So generally, yes, cleanliness is a big problem, and we need to work on it. In general sense, and the look and feel of our hospitals needs to be done. But in ICU, there are a number of factors that we need to take into account besides what we talk about generally about hygiene.
MEC, it's a conversation that for years and years and years we've been having, and I feel that you're downplaying this, and I feel that you're not taking this as seriously as it should be. Let me repeat again, 2,000 babies lost their lives in Gauteng hospitals. These are healthy babies that are born into an inadequate health system. How can this be allowed? You know there's overcrowding. We've discussed the overcrowding. You know that this is aware. You yourself have just admitted that hygiene is a problem in the hospitals. And when we talk of accountability, we are talking about things you know that are not being fixed. And that's taking this very, very seriously and not downplaying it.
Okay, I'm not sure if you want me to be acting agitated because
I would expect you to apologize. Don't you think you should apologize to those parents that have lost their lives, their children's lives?
We have already done that through redress process, and we are continuing to do that. We are not in any way saying that we are not sorry about what happened, but again, you also missed the point, about how we are talking about babies that are preterm, deliveries, which are not necessarily healthy babies, which are babies that are normally vulnerable in terms of infections. They are very normally vulnerable in terms of lung injuries. So these are problems that we face when we talk about preterm babies and preterm deliveries, and also talk overall about the numbers of the babies that have been born in Gauteng. Then you would understand that we are not only dealing with a very small number of patients, we're dealing with a high number of patients, and we are having a problem about dealing with the overcrowding. Infrastructure adjustments are being done and have been planned. The issue of infection is being done in terms of controlling all our ICUs and also the general look of our hospitals. And these are things that are underway. We are employing nurses every day as we are speaking. So we are working on it. And I think at the 6th administration, basically we are aiming to resolve these problems. These are problems that we are not going to see going forward, because we're aiming to improve from one situation to another.
Okay, MEC, we'll certainly will be watching this and hoping that this is in case. But I mean, the reality is that premature babies are born every single day, and many of us walking around with premature babies, and we lead perfectly healthy lives if we get the adequate care when we are born. So I don't think blaming it on the fact that babies are premature, that can lead to their deaths. It's unfortunately the situation in these hospitals that have led to their deaths, and that is something that we need to take and accept responsibility for.
No, I think you also not very quite accurate about the problems of preterm deliveries, because in the studies have shown that even if they are born in Japan, and the issue is that they would be having other problems that we have to deal with. And these are problems that we have to mitigate all the time. We are trying to improve our situation every time. We are trying to improve so that we improve even the weights of the babies. Like, for example, the babies in terms of the weights that have to be admitted in ICU. At some point it was 1 kilogram when I was training as an obstetrician, but now it's 850 and is going down to 750. So there are things that we are doing correctly, moving towards that direction of trying to save every single baby, because that's what medicine is all about, that we have to do that. But reality also has to be there. We need to be real to that fact.
Right. We have to leave it there, MEC. Thanks very much for joining us here on the program on this Wednesday morning, the 22nd of January. That was a conversation with Bandile Masuku, who's the MEC for Health in Gauteng, giving us an update on the death of 10 babies at the Tembisa hospital. The time is 8 o'clock. Let's get your news here.